History taking is very important whenever we are dealing as a clinician, and taking a psychiatric patient's history is very challenging at times because we have a patient who has problems, who has psychiatric problems, and so taking points out of him is very challenging at times. A lot of aspects to the psychiatric patient history taking are quite differing from a normal history taking. If you're taking history in the medical wards or in the surgical wards, the counter history taking is not that important, and it's not emphasized upon. But while we are taking the history in a psychiatric patient, the counter history from his relatives, his friends is again very important. Even his physicians who has been treating him, his relatives, it's again very important over here. His past history is very important. His relationship history is very important. Drug history, if there is any substance abuse history, we have to take and we have to emphasize on these counterparts of the history taking whenever we are taking history from a psychiatric patient. And then again, the investigation has to be carried out by the psychiatrist, whosoever is taking the psychiatric history. He should have the core knowledge to the patient, how he was admitted to the hospital, what were the presenting complaints, and what were the history of the presenting complaints. And this history of the presenting complaints is usually taken by the people who has usually brought the patient to the hospital or to the emergency departments. So that will basically give you clues regarding the problem that the person is suffering from. So that is basically the crux over here, that we have to focus on the pre-investigation before we start taking the history from the patient himself or herself. So the background knowledge is very important for a psychiatrist over here. In this section, we'll be focusing on the basic principles of history taking, obviously in a psychiatric patient, and then establishing a timeline. So how do we basically establish a timeline? It's basically you ask the patient the sequence of events that he remembers, or his account is very important. What account he's giving of the incident is again very important. It's basically his side of story, but again we'll basically counter clue it after taking the history from the relatives or from the people who brought him to the emergency department, just to emphasize upon the fact that is he telling the truth, or is he just making up the stories, or hallucinating, or he's having the delusional phenomena. So these are the things that we have to keep in our mind. Then understanding the patient and empathizing with the patient is again very important when we are taking the history from such a patient. Now, first of all, the process of obtaining information and testing out hypotheses within the aim to fully understand the nature of patient's experience. This is again very important. You basically start by investigating the patient's experience, and you basically listen to his side of the story first of all in detail. This is very important over here. When psychiatric and physical symptoms, they occur side by side, they are present simultaneously in a lot of patients, and the physical disorders may have the significant psychological components. So, as we've already talked about, there are a lot of somatoform disorders and there are a lot of psychosomatic disorders in which the physical symptoms, they are going to affect upon the psychiatric state of that patient. And then it can be vice versa, that is the psychiatric analysis of a person can affect the physical state of that person. So this can be basically interrelated, and they're usually present simultaneously in a single person. So we have to look for the signs and symptoms of all of these phenomena. Now, the basic principles of history taking that we usually come across are basically begin with the open questions. The questions should not be closed-ended, and they should not be directional that are put forward by the psychiatrist. He should basically give an open end to the patient to talk about his incidents, to talk about his feelings and the way he feels about the people surrounding him. Does he have any paranoias or delusions, or does he have any auditory or visual hallucinations, or any tactile hallucinations? So these questions should be open-ended, and the patient should have the chance to talk more about his feelings and the incidents that are surrounding him. Then, secondly, we have to focus on the fact that he has to shift to more directive questions to clarify what patient means and what their symptoms are. So again, it's very important, and establishing a timeline. So we have to set basically the problems that has been occurring to the patient, and what was the timeline of these problems, which problem appeared first, and what was followed by this problem. The sequence of patient's experience and the relevant events that took place in his life. So if there is any grievous event that took place in his life, and after that he suffered an episode of depression, so that is quite normal for that patient. Allow the patient to talk. So don't intervene between the facts whenever he's talking. Let him talk. Don't put the closed-ended questions. That is basically the same phenomena that we're talking about. Then try and obtain an understanding of patient's experience. So empathize with the patient. Be empathetic. It's again very important working as a psychiatrist that you empathize with the patient's feeling. If he's feeling angry, you shouldn't say that he should not react to situations in that particular way. You should basically empathize with him. You should know what grievous events or what disastrous events took place in his childhood or even in his current life. So these are basically the basic principles that we have to follow whenever we are taking a history from a psychiatric patient. Now, establishing a timeline, we have already focused on the fact that the psychiatric disorders have an insidious onset. A vital step making the timeline is again very important over here. The patients may confuse the chronology of the illness. That is basically, whenever we talk about the chronology of the illness, he may basically shuffle the incidents that took place later. In his memory, maybe that incidents didn't even take place. So after you take the history, the collaborative history from his relatives and his friends, you'd come to know what is the truth. The clarifications and the use of the fixed time markers is again very important. You'll basically ask questions from him. Did this event took place when it was the summertime or when it was the Christmas time? So basically, you're basically collaborating the events with the time. So this is very important to take the history in this way. The identification of the symptoms and the onset of the progression is again very important. The severity of the symptoms has to be looked for, and it has to be asked for the patient how he feels about the severity of the symptoms. Now, basically, it is common to all the histories. The conversation in the patients has to be very friendly. It has to be open-ended, making the patient feel valued at all the times, and making the patient talk about their experiences. So it's again very important. The full elucidation of the patient's issues and establishing an effective working relationship between the doctor and the patient. So without understanding the patient, no successful intervention can be done. The management would not be very successful in such a case. The clarification, what the patient actually means, is again very important. So you're going to ask him again and again, do you mean this? Do you mean that? And that is basically going to clarify the situation more to you. Taking cultural issues into considerations. So it's again very important. And integrating the cultural issues with his problems is again important. So the environmental factors, as we've already focused upon this fact that they play a vital role on the psychiatric assessment or evaluation, is again very important. Don't be judgmental when you're treating a psychiatric patient. Alternative views on what is learned from the patient is again very important. The key components over here are the mode of presentation, the legal status, the history of presentation, the patient's perspective on how does the patient conceptualize the problems, family history, work history, relationship history, and forensic history. If he has any legal issues, what he had in the past. Current circumstances are again very important. Previous psychiatric and medical history is again very important. If there is any substance abuse, for example, alcohol or recreational drugs, if it had been used by the patient or not. If the patient's personality was pre-morbid, and it's basically asked from the relatives and the friends. The corroborative history from the friends and family has its own significance over here. So basically in this section, we focused on the main points that we're going to ask from the patient while we are assessing the patient, and the history taking is the mainstay while we are dealing a patient of psychiatric issues. So that is the end of this section. Thank you for watching sqadia.com.